it's the miniaturization of tech that I'm the
Mm-hmm.
most excited about. So I think in general, just in the same way that computers have gone from taking up a whole room to now being acceptable, on your phone in your pocket, um, MedTech hasn't really done that as quickly because we haven't been motivated to do that. Because if we have a hospital that's already full of these large, bulky machines, the space is already accounted for. There's no reason to have a portable version. But I'm really excited about higher levels of care being able to move outside of the hospital and into the satellite clinics and then maybe even eventually into the patient's homes. And as things are kind of cheaper and smaller and able to be made mobile, especially in terms of monitoring technology and wearables that people can now have on their body that can provide some of the detailed diagnostic data that we previously could only get from a lab setting. I'm really excited for that transition to happen. So we can now know what's going on with a patient, between appointments, which was previously a totally blank space. And so we had these kind of 3 or 4 data points where we had really detailed data about what was going on with that person and no idea what was going on in between. And now we're finally getting to the point where things are miniaturized and cheap enough that the patient can have a small version of that device within their home. They can use it maybe once a day or once a week, and give us a more complete picture of what's going on with them. And our diagnoses and treatment are going to change drastically when we have that improved picture. Because there's so much more data that's going to be coming in from those more frequently collected data points, then you need management of large data sets, which is something that we haven't done in the past. But AI has the capability of doing it. And so now that we can take humans out of the number crunching, the combination of those two things of technology getting smaller, cheaper, portable, and of AI being able to process that increased data set is going to be really powerful.
Do you know that so far, I've recorded a few of these episodes already, and so far, this has been mentioned every time.
Really?
Wearables, more data, and then crunching that data using AI. Like so far, 100% of my guests have mentioned this. So definitely the excitement for that must be there. Uh, I wanted to
That's
take you into
hilarious.
the. Yeah, I know.
What's funny though, what's interesting is that the reimbursement for that process is somewhat there, but not all the way there. And so that's once again going into our theme of what's holding back change. That's going to be one of the things, one of the sticking points, that's going to stop that from being adopted across the spectrum.
Somewhat there. That makes me cautiously optimistic, at least a little bit, right? But it's easy.
So there
Yeah.
there is currently a reimbursement process for very cheap sensors that it pays about $50 a month for a sensor, but a lot of the things that people would take home with them might cost $100 or $1,000 a month. And currently there's no way for that to be paid for.
I understand. So I'm trying to build a picture in my mind. Could you be more specific about what kinds of machines currently we only see at clinics and hospitals that we might be soon seeing at home? I want to see this vision of the future that you're building.
Sure. I'll give you an example from my PhD segment. So biomechanics is this the topic, and there used to be these things called gait labs that were located, throughout the country. Um, Specifically, they would do a lot of gait analysis on children who had cerebral palsy. And they would do an analysis before surgery, and then they would do a surgery where they would adjust tendon lengths and muscle lengths so that that patient could walk better. And then they would do a gait analysis after surgery to see how much was changed. Now we have the ability to have pressure sensitive insoles that that patient could wear at home, and maybe some um, IMU wearable sensors that could be strapped to their legs, and they could just go about their daily life. They could run around in the playground or whatever it was that that kid was going to be doing that week. We can gather their gait data, and we can know how it changes as they grow. Instead of just knowing, maybe once a year or every 5 years that they would have come into the gait lab. And that can really help to inform. You can watch that data carefully until you see a change that's alarming, and then you say, okay, now it's time for surgery. Or maybe we don't need to have surgery because I actually see that this is improving as the patient moves.
And the data from that, out of curiosity, does that need to be somehow passed on to the clinic, or can they, day to day actually look at what's happening? I guess my question is it online? Is it in the cloud already?
Yeah, so, well-designed products have a dashboard that has a patient-facing component and a clinician-facing component. And so the patient-facing component, in this example, the child with cerebral palsy and their parents can maybe look on their cell phone and say, "Oh, you took, 1,000 more steps today than you did yesterday, and your gait speed was a little bit higher, and I see that your range of motion is looking like you are progressing more towards the optimal range. We must be doing something right. Let's keep going with your physical therapy or wearing your braces or whatever the intervention was." Or they can do the same thing and say, "Uh-oh, I'm starting to see a worrying trend. Let me make an appointment with your doctor." Meanwhile, on the doctor's side of things, the patient can call and say, "Hey, I'm a little bit worried about, my child's data. I wanna come in and have a checkup." And the clinician can look at their dashboard and say, "Oh, I agree. Look, I'm seeing a trend, that seems a little bit worrying." They might have, a level higher detail, and they would be able to say, "Okay, yes, now is the time for you to come in, and it looks like you should come in within a month, or we should get you in tomorrow," based on how concerning the trend is.